Hi, my name is Mary and I'm a citizen journalist with Access Dorset, a local organisation that champions the rights of disabled people, older people and carers. As someone with a strong interest in health and social care, I was really interested to hear about the annual members meeting of the Dorset HealthCare University NHS Foundation Trust. The Trust provides a whole range of community healthcare services across Bournemouth, Poole and Dorset, including community hospitals, health and mental health services. I've come along today to the Trust's annual members meeting where board members have invited service users, staff, families and carers to take part in discussion groups because they really want to be held accountable by citizens.
What we really want to do is make sure that we get the most diverse group of people as we can, joining in the chat, joining in the debate, so that the board and the senior leaders have got a real idea of what we should be doing and where we're going with these things.
It feels like to me that the board are really open to the discussion with patients and service users.
We've got our facilitators and some people who are going to be sort of scribing. Each discussion group needs to have its 3 key points, its 3 issues, so it's over to you really.
Sometimes there's not enough information.
Social care and health together around locality.
These things matter to me, and I want to discuss those things. Because
I sense a real sea change. I sense that people are now engaging in a very real and very new way with the Trust.
When it was suggested that we used the annual members meeting as a way of hearing different people's views, I thought it was a fantastic idea.
Hopefully a little bit of what I've shared is going to help shape what other people receive as well.
It's an opportunity to sit round with people, with clinicians, with service planners and designers to actually talk about some of the real issues and brainstorm and problem solve what some of the solutions might be.
Help people to maintain their well-being and not get to crisis.
So really about capacity building for communities to do it for themselves.
Physical health to take from mental health.
We had a really good session in our workshop. We looked at promoting the Trust and getting 3 key ideas together about how we can promote awareness and knowledge of the Trust throughout the local community.
Well, the next part of the meeting is where we get to put our points raised to the board.
Point 1, using more people with lived experience to support other people in mental illness.
We can encourage all of our services to look at the services that they're delivering.
The second point we looked at was about health and social care.
What carers would seem to want is information and support.
I think it is being taken seriously, what's been discussed. Certainly my experience today is the Trust has become a listening trust for staff as well as patients. So I look forward to seeing what the board chooses to do with this really.